Hi, I'm Dr. Bai Yu, Associate Professor of Department of Gastroenterology, Shanghai Hospital at the 2nd Military Medical University of Shanghai. I'm also the co-corresponding author of an article recently published in GIE entitled Left Lateral T-Down Position on Cecal Intubation Time, a two-center pragmatic randomized control trial. It is my pleasure to introduce my colleagues, the authors of this manuscript, Dr. Zhao Shenbing and Dr. Xia Tian.
Dr. Bai, how did you come up with this idea, and what was your motivation to do this study?
Well, traditionally, when we start colonoscopy procedure, the patients are placed in left lateral horizontal position, LHP. However, there is no strong evidence demonstrates its efficacy and advantages versus other positions. And this traditional position, which results in air rising away from the left column and producing acute bends in the sigmoid, increase risk of loop formation and might be associated with increasing pain, procedure time, and more adverse event, such as splenic injury and perforation. Traditional T-down position is usually used in abdominal surgery to allow for better access to the pelvic cavity. As the gravity pulls the bowel out of the pelvic cavity and straighten the rectal sigmoid angle. Therefore, it may be useful to facilitate colonoscopy insertion. Several pilot studies have suggested that left lateral T-down position, a modified Trendelenburg position, could shorten the duration of insertion, but no trials has been reported to evaluate its safety and efficacy for colonoscopy insertion, especially for unsedated patients. Therefore, we conducted these randomized control trials on unsedated patients to determine whether LTDP is superior to traditional position in terms of safety, insertion time, and patient comfort. So, Dr. Zhao, would you please introduce how this randomized control trial was conducted, and what's the outcome and its meaning?
Well, this randomized trial was conducted at 2 endoscopy centers in China. A total of 258 patients were included. 123 patients in LTDP and 122 patients in the LHP group were available for final analysis. Because 30 patients were excluded for incomplete colonoscopies, the baseline information of the two groups of patients were comparable. Starting colonoscopy in LTDP resulted in a shorter median cecal intubation time than that in LHP. Experienced endoscopists and patients with high or low BMI showed a greater reduction in cecal intubation time. In addition, colonoscopy insertion in LTDP group also was less painful and less difficult. Patients in LTDP group also showed a higher tendency to accept unsedated colonoscopy. The rates of complications were extremely low and did not significantly in two groups. We believe this study is important because this trial firstly demonstrated LTDP safely and significantly facilitated insertion process and reduced cecal intubation time on unsedated patients. Additionally, our findings showed a lower pain score and a tendency of improved acceptance for unsedated colonoscopy with LTDP position. The results suggested that LTDP as an easy and convenient method could be help to insertion process, reduce pain, and improve acceptance of unsedated colonoscopy. So, Dr. Xia, what is the next step?
Well, this study also had some limitations. First, this RCT was performed on an Asian population of patients, and the results might not be generalized to patients in Western countries, who have a much higher prevalence of diverticulosis. In addition, there could be some difference of maneuver or techniques between Chinese and Western endoscopists. So the results of the study need further investigation in Western populations. Second, to accurately evaluate the pain score of patients. All patients in our study were unsedated, so we could not determine the safety of LTDP in sedated patients, even though previous pilot studies did not report occurrence of major adverse events. Therefore, more evidence was needed to ensure the safety and efficacy of LTDP in sedated patients.
In conclusion, our study demonstrates that LTDP during colonoscopy can safely facilitate insertion process and reduce insertion time in unsedated patients.
Thank you.